Welcome to Sports Doc Talk. I'm Will Sanchez with our favorite orthopedic surgeon and sports medicine specialist, Dr. Garcia. Dr. Garcia, can you believe we did not win the Golden Globe for Best Podcaster? They gave it to Amy.
Unbelievable.
I was like, wait a minute, we got robbed. I mean, this injustice. This podcast, we have a great guest on, but we're going to rant and rave. We demand a recount. What are your thoughts, and how you doing?
I'm good. I totally agree with you. We got good backgrounds, so there's really no excuse for what happened. But nonetheless, I'm excited for our next guest. This will be a good change of pace from some of the other ones we've had on here, so this is great. But first, we got to talk about our sponsors.
Let's talk about Mike B. There you go. There's our guest there. But Mike B at the Recovery Shop. We love them. Mike B is great. Remember to contact Mike at Mike B at shop-recovery.com. Dr. Garcia, why do you love Mike B?
I mean, they just work well for us as surgeons. As surgeons, we have patients that get complicated surgeries or they want something extra after surgery, and it's really nice. And even as we modify our protocols, they can adapt pretty easily, which is really nice. So, we're a nice machine. We're trying something new with different things every day. And those are there for the patients. And I talked to my patients today before surgery, and they're like, hey, I really liked using this. I felt really good about getting all the stuff that I needed before surgery. Or if there's an issue, they can take care of it after surgery. So it's great. So thank you to our sponsors. But now moving on to our guest.
All right, everyone. Today we have Dr. Brigitte Rozenberg. She's joining us. She's an LA-based spine specialist with over 30 years of experience, and she's the creator of Advanced Spinal Restoration Therapy. Don't worry about it. Dr. Garcia and Dr. Rozenberg explain all that. That's not my job. That's theirs. We just want to let everybody know she's worked with high-level athletes across every sport you can imagine, lectures nationally on spine mechanics, collaborates with orthopedic surgeons like Dr. Garcia to help figure out who can avoid the operating room. Brigitte, welcome to Sports Doc Talk. We are really glad to have you. Thank you for joining us.
Thank you for having me. I'm excited to be here.
We're excited to have you. We'll just kick it off real quick. Dr. Rozenberg, 30 years in spine care. Thousands of patients, Olympic level athletes. I'm curious, what's the most rewarding text message or phone call you've ever gotten from a patient that made you think, yeah, this is why I do it. This is why I love it.
I love it. Yeah. I mean, every time when they feel better, when they're back in their normal realm, when they're back in their normal lifestyle, of course, if it's an athlete and he's back in the court or back playing or doing whatever it is that they're doing, it's extremely rewarding, very rewarding to be in this position day in and day out. And to even know that there's just so many things out there that we can do to help them, because it's never like a one thing. It's never like one answer. It's just someone told me once, you don't choose the profession chooses you. I really, truly feel that. So it's just rewarding to be in this place. I love it.
So, and I think this is really interesting, as Will mentioned, and I was saying this, you're a different bit of guests that we have. Sometimes many of the guests we've had are surgical intervention, right? And so it's nice to have someone who does no surgery to talk about that side of things, especially when it comes to spine surgery. Because as we know, spine surgery is a different animal than some of the other surgeries in terms of outcomes and choosing the right patient. And really the non-operative stuff is something that we really like to do a lot of, or at least focus on, but many of the surgeons are not as good at that. That's right. We're called surgeons. We do a little more of the surgery part, a little less of the non-surgical. So it's good to have someone like you on there. We've touted this sort of advanced spine restoration therapy. Will you talk a little bit about kind of what brought you to design this and a little bit about the program itself?
So, I've been a chiropractor for many years, and I always, in my field, just like in your field, you can sometimes specialize in like doing surgeries on knees or shoulders or hips or spine. Everybody kind of finds their niche of what they like to do. I always treated patients after some kind of trauma, whether it was an accident, work-related accident, sports injuries, car accident, people that are really like in pain. Not, of course we can all do regular wellness, but that was always the kind of work that I was drawn to and the patient was drawn to me. And so over the years, there's just so much you can do with your hands, or so much you can do with rehab. And, as we progress, we have so many new technologies, and with the advancements of medical technologies, we can achieve so many great things. And when I start noticing and seeing it, I always use different modalities in my practice. But as things advance, I see that putting them together in a very specific manner got so much more results for a lot of these patients, a lot more that you can achieve with just doing your hands or just doing rehab, and definitely just by taking medication. And I think that's what kind of led me to put that program together that encompasses all these different modalities in a very specific, formalized manner. And that's how we get the result. It's not one thing, it's a combination of multiple things.
Will you give the audience a little bit of your background? I mean, obviously you've been in practice for a long time, but kind of where you started, and then I know you mentioned how the patients you have, but how did you kind of get in this direction of doing all this?
So when I started 30 years ago, chiropractic was a little bit out of the mainstream. It kind of had its own little world. But my first job was in a medical group that actually, funny enough, it serviced the studios where you had the Golden Globes yesterday. So it was here in the LA area, and the medical group I was part of was servicing those people that were either getting ready to shoot a movie or were very active while shooting movies. So we had to go on set, along with seeing all those laborers that worked on the set. And so those are the kind of people that we saw. So it was either, they had some injury, or they needed to prevent injury to some point, or, they fell at work, or they were lifting something extremely heavy. And within that realm of working in that medical group, I also saw a lot of patients that were injured after car accidents, and they were severely injured, like severe rear end, severe concussion, like different things that they were looking for additional form of therapy. So that was my early, career. I was there working alongside physical therapists. It was like within the physical therapy department, they had chiropractic and physical therapy, and working closely with medical doctors and orthopedists that were coming in. So this was kind of like where my career started. And I, was drawn to this. I always liked it. My mother was a physician. And so medicine was always in my life. But when I chose to become a chiropractor, I just really liked this whole interaction with the patient. I myself was treated by a chiropractor, and I really liked that work. But I always, what can I do within that profession that was a little bit more than just adjusting patients? And working in the medical, in a medical group, working alongside the physical therapist, working closely with orthopedic surgeon, it's kind of like led me to that line of work. I've always done that. And then 6 years ago or 7 years ago, it was before COVID, I was introduced to this concept, which I knew, I just did not have the latest technology, called a non-surgical spinal decompression. And what really attracted me to that was non-surgical spinal decompression is a great treatment for patients with herniated disc. Or I was thinking, well, I see so many patients with herniated disc, I can help them, but I get stuck. Like there's a certain
level.
Let
me pull up that slide.
Yeah, exactly. So, you help them, but then like you can't achieve a full result of the treatment. Like you can't adjust them. When it's too hard of a disc, you can manipulate on that. When the patient is in severe pain and they have sciatica, you can't put them through any rehab because they can barely do anything. Like they're in so much pain. So I constantly felt like, well, there's not much that we can do. And when I was, when I not was introduced, but when I realized the new technology that's in the realm of non-surgical spinal decompression, and I took many classes and got certified, I was like, wow, this is amazing. This is almost like the missing link of what I needed to have in my practice, but I didn't have, because over the years, 30 years, I have machines, I have ultrasounds, and I have low-level light therapies and different tables and different flexion distraction, but things are evolving. I always say the cell phone you have today is not the one we had 10 years ago. So I was exposed and introduced to the new technology, which I thought was amazing. And that's why I decided to bring it to my practice. And, I have 3 locations. So everything you do, you have to kind of do for 3 offices. It's a little bit complicated. But, the more I did and the more I treated the patients with these technologies, the more results I saw. And the results were incredible because, I have LA is very diverse. We have patients from, many different diverse cultures. And there are some people that for religious reason will not want to have surgery. There are some people that for cultural reasons don't believe that the hospital is going to help them or the doctors are going to help them. So, I see all those different patients from all those different walks of life. And then I see patients that whatever the doctor will tell me to do, I'm never going to change that. So you see it all and you basically treat them no matter where they are in their life. And then you start seeing those results. And then you bring another equipment in, and then you kind of see better results, and then you develop a better technique. Just like in anything, it takes time and skill. It takes time and repetition to sharpen the skill. And so I've done it so many times, and I've added so many different tools that are so beneficial, that when I decided to put it together, because I'm like, okay, so when are we going to use the laser versus when are we going to use the SoftWave versus when are we going to use the non-surgical spinal decompression table? And then I really thought about it a lot and seen so many patients, I decided to formalize a treatment plan and give it a name and a method, so we can have a little bit better structure and not kind of do things just for the sake of doing things. And that was my story.
I like this. Yeah, we had a physical therapist on that kind of talked about a method he used, a similar thing, just in order to make it more structured. Will you talk a little about the devices that you use? I think we might show one. Is this one of those that you want to talk about? We'd love to hear a little bit about this. We've got a few. I think these are things that I don't get to see as often because we don't do a lot of the non-surgical things. So it's really cool to hear this and kind of hear your thoughts on this and the combination.
Right. So, I always say, because the way that I practice all my careers, I always practice alongside surgeons and pain management and neurologists. And I always say, it's all about collaboration. It's not instead of, it's in addition to. There's many things that I do that you guys don't, many things you do that there's nothing that it's not even close to what I do. So I think the collaboration always works. And I worked with a neurosurgeon once who told me, 80% of my cases don't end up on a surgical table, because if I can avoid spine surgery, I will try to do that. But it's just, the problem is sometimes conservative care fails. And so they need something a little bit more, different intervention, and that's where the surgery comes in. But those devices that I am going to show you and I'll talk about, they're used by some, this particular device is used by a neurosurgeon and I've met and I work very closely with. So this is called the Sculp Neo. This is a very interesting device, and it's just the latest addition to my, mix here. It used to be used for many years for aesthetic purposes, because this is the only device in the market that builds muscle, burns fat, and tightens skin. So you would think, okay, well, what does that have anything to do with you treating patients with pain? But as you know, a lot of people with back injuries and disc injuries, which what I see a lot, they develop muscle weakness and fatigue and atrophy. And so
100%.
weak muscles cannot support weak joints. Like, in order to support a joint, you need to have strong muscles. Whether you have surgery or you don't have surgery, like, you have to strengthen the muscles. Some of these people are having a very hard time rehabilitate themselves back to normal just with PT. They're just too weak all around. So this device causes, in 30 minutes of treatment, it causes 20,000 muscle contractions. So when you apply it on the abdomen, yes, of course, initially it was introduced as a sculpting device, more aesthetic, but patients with weak core muscles, they'll always have back pain. Patients with weak glutes, they can recover either with surgery or without. They need to strengthen those muscles. So the Sculp Neo is a brand new device that was recently FDA cleared to strengthen muscle and to reverse sarcoidosis, which is basically, muscle atrophy. And it is a great add-on to patients, whether they had surgery or they didn't have surgery, or they're in between. They had epidurals, it didn't work. They didn't have it. Any and all in between can benefit from. This is one of those modalities. So I recently added that to my Advanced Spinal Restoration as the rehab component, because once you strengthen their abdominal muscles, they call it, like, the protocol is core to floor. Like, you need to strengthen the pelvic floor muscles, the abdominal muscles, the glute, the hamstring. Then you can go and rehabilitate back and do whatever you need to do, because you can't just live on using these devices. So when you incorporate something so powerful, the results are unbelievable. And they submitted a study and FDA cleared it for functional wellness, and this is now the greatest thing in the market almost.
Is this something that you can only get at your office, or is this something that a patient can take home and use? We started the show talking about the recovery shop, and how to get equipment to help with your recovery. So I just want to know, if someone's interested in a device like this, what's the process? Do they need to see you first, or do they have the option to do something else to get their hands on this?
So this device is not something you can buy. I mean, clearly you can buy anything if you have the money for it. It's very expensive, but this is not a home use device. This is a device that's primarily used in a clinical setting. So it has to be an office that carries it. A lot of doctors now carry it. Like I said, one of my close friends, it was a neurosurgeon. He carries this device in his office. I have it in my clinic here in LA, and there are other doctors that carry it, but you normally cannot buy it and use it at home.
What's the treatment like? Is that once a week, or it depends on the severity of the injury, or twice a week? I'm just curious for anyone that's interested and want to come in and say, hey, this is kind of what's recommended, or is it all dependent on the patient?
So we have a treatment protocol for this device. Each treatment is about 30 minutes only, and we can basically use 2 areas per treatment or per day. So let's say you come in for just using this device, right? So let's say you come in and we do 30 minutes in the ab and 30 minutes on the glute. That would be one treatment. So 30 and 30, it's 1 hour. So minimum 30 minutes, maximum 1 hour, and it can be used in each area. For rehabilitative purposes, you need to do minimum 4 times. So if you want to strengthen the abdomen, the core, you need to do minimum 4 visits on the stomach. So, or on the abdominal muscles. So at least once a week, it's the minimum. Twice a week, we don't do that more than once to twice a week. So that's the frequency.
Well, and it's good to have this. It's really interesting you kept saying that, because, even today I had patients in the office post-operatively or pre-operatively, and they're upset about whether some of them are happy, or some are saying, hey, I'm not where I want to be. But a lot of it is the recovery, right? And as a surgeon, my PTs that I send people to, they don't have some of these options. They have E-stim, they have blood flow restriction. Those are kind of what we do. But again, it's an extremity scenario. But having something like this is really cool from the post-surgical recovery side. Obviously, I'm thinking like a surgeon, but I'm also thinking about the patient I saw today that didn't need surgery, and I don't have the solutions for it because I don't have all these tools. It's nice to have that, especially as a spine surgeon. If you see patients, like you said, if a good spine surgeon only does surgery on 20 or less percentage of patients that they see, but we know that's not always accurate. And that's because we run out of things to do and we don't have the right people to contact. And so it's really interesting that something like this, the ability to, surrounding the joint and getting the strength up there is really important. So I really like the idea of that.
And this is one of many. Yeah. We use many modalities, but this is a really strong one that is really, I think it's a lot more, it's starting to be more common, but I would consider our office being more on the cutting edge. So we buy those machines and offer it to patients, but clearly you need to have an office that would buy those equipment to apply to the patient when they come in for rehab and therapy.
Well, and you need the right patients, right? You're in LA, I'm in Seattle. Right? If you're in the middle of the country and there's different focus on different things, or it's different injuries or different aesthetics or things like that, right? You're in an aesthetic city with a machine that works on focusing on abs and lower back. You can see that it'd be easier to get than it would be in a less aesthetic place too, as well.
I wanted to use that. I was getting ready for South Beach.
I know Will's going to get jacked.
I was like, I could get ready for the summer right now. We're ready for the beach, but no, it's for physical therapy. It's for healing. Okay.
That's right.
We can use it. We can sculpt you. Make it.
Yeah, he doesn't need to be sculpted. Look at him. So anyhow, let's show another modality. This is a really interesting one. We'll pick the laser. Yep. This is something that at some point we'll have another episode on. But this laser therapy is a humongous topic in orthopedics right now. Right. And there's been some AAOS and orthopedic things, but I don't want to take away from your thunder. So why don't you talk a little bit about this edition and what does this do?
Well, this is a laser device. It's a class 4 robotic laser. The reason why I added that machine into that specific laser into my practice and not a different laser, because class 4 laser can be, if it's used inappropriately, it can hurt someone because it can be hot and it can injure someone. This particular device has a robotic head and it's a cold class 4 laser. So it's not going to hurt anyone, meaning it's not going to burn you. Now, the class 4 laser, normally the way it works is that, it's called photobiomodulation, and it stimulates, it reduces inflammation, it accelerates cellular repair and cellular healing, and it will increase blood flow. So when you use this now in conjunction, and you'll show some other slides with other machines. So I see patients, with disc injuries, big disc, smaller disc, whatever. And so they have a lot of pain and a lot of inflammation, because always inflammation always goes along with all these injuries. So you need to reduce the inflammation, the internal inflammation, and you need to increase the cellular healing. And there are thousands of peer-reviewed studies showing how laser therapy is so effective, just like you said, in orthopedics. So when you use that in conjunction with other modalities, you're able to reduce inflammation one way, increase cellular healing another way, strengthen muscle a third way. So you work, how should I say, it's like a very comprehensive approach to the injury. And when you comprehensively attack the problem, you fix it much faster. It's a really great pain management device. It's not dangerous. It's not painful. They feel nothing. It's very limited, not a lot of time. It's 10 minutes max. It works well.
Was this something you would mix in the same day with that other machine, or is this something different modality?
Yes, I have a formula that I mix in the laser therapy, SoftWave therapy, specific electrical stimulation out of TENS unit. And then the last piece of the 3-faceted approach is the Rehab, that I incorporate the Sculp Neo that you saw.
And do you think, again, I know this is multifaceted, but do you think the idea what you're doing by calming the disc, not only are you working to calm it, but you're working to strengthen everything around it, right? And that becomes really difficult. If you've ever had a disc herniation, which I've had, it's terrible and the pain is unbearable. And even if you feel like you can push through it, it's very difficult. And I didn't even have the hottest disc of any of my friends that I know. So, you get a really hot disc, it's very hard to do anything. So you can imagine finding a way to drop the heat of the disc, but also to strengthen around is really important, especially when you can't move.
Absolutely. That's what we do all day, every day. A lot of our patients, they have, we see patients that either were told, well, try everything you can, and if it doesn't work, come back and we'll do surgery. We see those patients. We see patients that had discectomies, minor, minimally invasive surgeries, and they have a reoccurrence, and they're like, I don't want to have another surgery. I want to try to avoid it. We see those people. And we see those that say, I don't want to have any surgery because I'm too scared. My neighbor had it. My cousin had it. The results were whatever. So I'm trying to avoid it and try to do whatever I can. So our approach is, well, first of all, when we use the non-surgical spinal decompression, so we decompress the disc. And I'm looking at all the slides, you don't have the picture of the main component, which is the ACUSA. That's a different machine, but I will
show this. Is this the table you're doing, or we take away your thunder?
Okay, yes, this is it. So this is a decompression table. So if you can see closely, there is a computer next to the table. So this is a computer-generated axial decompression, meaning we input the data into the computer that's based on your MRI results. So if a patient has a herniated disc of L4, L5, which is the most common, we will then input the data into the computer of that system. It's called the ACUSA system. It's made in the United States. And then what happens is we adjust the decompression. So we adjust an angle. We pull the spine right, targeting the L4 and L5 disc, which is about 15, 20 degrees of pull. And so if you see on the table, it has a big tower in front of it. And the way the patient lays down, we harness them, and then we will adjust the angle of the pull, targeting that particular disc. And the way that this system works, it's kind of like in a progression, regression kind of a manner. Think about it like a pumping mechanism. It pumps it, and it decompresses the spine, and by doing that you create a negative pressure in the disc. So I always give an example. It's like a plunger, and you basically allow the body to suck the disc material back in place. So when you do that treatment very gently and a very, because we adjust the weight based on the patient weight, we adjust the pull, we adjust the time. And when you do that very gently, and then after that treatment, you apply other modalities to reduce the inflammation and the pain, then you apply the laser therapy, then patients feel better slowly and slowly and slowly, and you baby step it into the full recovery, but that's how they feel better. Now, if they need some medication, and they go to their doctor, or maybe they had an epidural and they feel a little better but not 100%, then we add that in. But if you use it in such a formulated manner, the right cadence and frequency, you really are able to get the result. And that's how we get the results with these disc patients.
Dr.
This
Rozenberg,
is really interesting.
Just real quick here, you're pretty much in a field of pain and relief, right? I mean, for everyone that's had back pain, and Dr. Garcia referenced it, whether it's arthritis or piriformis, or like you said, a slipped disc, a herniated disc, you're having patients coming in at all ages with different pain thresholds. How do you manage that, and what are some of the key communications that you have with your team when you're dealing with patients that are in constant pain and you're trying to find relief? What is that thought process that goes into it?
So, first of all, you have to be very compassionate with these people, because they're coming in, they're in a lot of pain. So these are people that tried everything. Most of the time, they've been everywhere. Like, we have patients that go to the emergency room and they're being sent back home with some kind of pain pill or whatever, because, and they're upset. And I'm like, well, the emergency room has to deal with emergency. They have to deal with a stroke and a heart attack. I mean, you have back pain, which is bad for you, but back pain is not an emergency. It's a disability. So, of course, it's really understanding the patient that's in front of you, having a lot of compassion, and training the team. Everybody on my team, whether it's the doctor or the clinical staff, they all go through rigorous certification program and training. Like, we don't just bring people and just jump them onto okay, here's a patient, go treat them. Like, they need to be properly onboarded. They need to understand the technology that we use. They need to know how it's being used, what it's used for, and they need to follow the protocol. So communication and relationship that we build with the patient is a very important piece. People that come in pain affects your mind. It doesn't matter if you're, how long you've been in pain. It doesn't matter who you are, whether you're an athlete that affects your livelihood and your career. And if you're just a patient that's, cannot function, cannot lift your kids, cannot play golf, whatever it is, it starts affecting your mind. So having that understanding with a patient is very important. Giving them that comfort that we are here and we're going to walk with you through this every step of the way, that's almost half of the recovery. Because if they feel comfortable where they're going and they feel heard, they feel like we pay attention to them, they feel like we're gonna be there for them every step of the way, they can come see us. Sometimes I tell you can come every day if you need to for the first few weeks so we can control the pain, but the ideal situation is 3 days a week. We're not going to do the same treatment every single day, but just the thought that when I'm telling a patient you can come here every day, 4 days a week. Just if you're in pain, just come here. We'll try to do something. That comfort level is really easing the patient. It's like, okay, I feel like you'll take care of me. Whether it's going to work 100% or not, we'll see. But at least I know that you'll take care of me. And so I think that is the differentiating factor between us and just doing things to do things. That's just not how we do it here at Spinatomy. Does that make sense?
I think that's great. I want to go back to this table one more time because I think it's really cool. So I think for the viewers, if you show the picture, and we can just do this really quickly here, which is kind of cool. So you can see how the way that the lumbar spine is curved. So she's talking about the angle that they're going to pull it at. So if you just pull straight up, that's great, but that's axial. That's just straight traction, and that doesn't always work for everybody. Do you have? Does this table go canter this way or that way based off what side the disc is on?
No.
As well, or is it most up and down?
So the way it works is the table will stand up in this position where the patient is actually going to lean against the table. He's going to stand up because patients cannot just jump on a table, and sometimes they have a hard time laying down. So they're standing, and then the table kind of goes down into that horizontal position. And then we harness them before they even get on the table. And so we kind of do all of it, and the table just pulls in just this direction. However, the way that it pulls in a horizontal direction, the angle, if you see that big tower in front of it, the angle of the pull, that will be determined of us, the doctor, kind of programming the pool. So if I work on L1, L2, that pool will be about 30, 35 degrees. But if I work on L5, S1, or L4, L5, which is lower part of the lumbar, then that pool will be about 10 to 15 degrees. So the pool will determine, where, what we target, but the patient does not move, the table does not move, they're very comfortable. 99.9% of the patients fall asleep on the table, and this is the position that they have the least amount of pain when they have a hot disc, because they're very comfortable. They have a bolster under the knees, they have something underneath their arms, like everything is very ergonomically made for them to be comfortable. So just the table and the system creates that pool, that event to decompress the spine that relieves the pressure from that disc.
Yeah, and also it's the decompression of the muscles around it, right? They're really hot as well, so the whole thing just relaxes. And I can imagine those patients coming in. I mean, I deal with patients in pain, but they're in chronic pain, and they're in a different. It's not the same as nerve pain like you deal with, but it's all the stuff you mentioned about compassion. It's really important, right? Because and you probably see this too. But when you make the patient better, they are a different person.
Correct.
It's very frequent. The personality of the person that coming in, they could be abrupt, they could be angry, they could be upset, they could be disruptive almost.
Yep.
And then you fix them and they are like a different person. So that's kind of a rewarding part, but you have to work to get to that, right? Because you don't know that at the beginning.
True. I want to mention one more thing about this particular system, the ACUSA. The reason why I chose this system than others is because this system has a very gentle motor. So it's very gentle on the spine, and it has a patent within the mechanics that's called oscillation. So in the process of decompression, it oscillates the tissue, micro oscillation. You don't really feel it, but it prevents the muscles from going into spasm. So when you use it, when the patient is on it, it's very comfortable and it's very, soothing. And so when they get off, if they have pain, we ice it, and then we kind of go through other forms of therapy to reduce the inflammation. And it's very comfortable. It's just a matter of repetition.
What's the biggest myth that you're dealing with when, people hear about spinal decompression? Is there something that, people walk in and they say, well, when I hear spinal decompression, I think you're cracking my back or something like that. What do you tend to hear that you're like, no, that's not true, this is what's happening? What's your biggest myth?
So interesting. Few. So one thing,
Few.
Okay. They say, I don't believe in this. I'm like, well, okay, I respect that, but this is not a religion. You don't believe. It's not about believing. This is scientifically proven to work. It's a mechanical fix. It fixes the spine mechanically, and a herniated bulging disc is a mechanical issue. So it either works or it doesn't. It doesn't hurt you. So I hear that, and I kind of, that's my explanation. And second thing that they say, well, I don't believe this how can this really fix the disc? And so then we go and we say, well, the disc is a dynamic structure, kind of like it's like a sponge. I always have those little models, and it's like a sponge full of water, or I say it's like a donut with jelly. And so when you press on it too hard, the water leaks out or the jelly comes out. And this treatment with this mechanics can actually suck this disc material back in, the jelly back into the donut. So the myth is like, well, is it going to work for me, or it only works on some people? I'm too heavy, or I'm too old, or I'm too this. And the reality, it works on anybody and everybody. Of course, you have to have certain parameters, and we go through the examination and evaluation to see if you are a candidate. But it doesn't matter if you're young or old, if you're heavy or skinny. It doesn't really matter if you're athletic or you're not athletic. It can work on anyone. So it either works or it doesn't, but 90% of our patients feel 90% better. So these are kind of like the things that I hear when I talk to patients.
Great. Let's go over this NeuroMed. Can you talk about this device?
Yeah, this is a great stimulator. It's called a NeuroMed. So it's electroanalgesia. Basically, this is a pain management device using electrical current. And the way that it works, it feels like an electrical stimulation, But just to give you a little bit of understanding, you know what a TENS unit works up to 250 pulses per second, and you can buy it on Amazon and use it all the time. Then a regular electrical stimulation in a rehab facility works up to 800 pulses per second. This device works up to 10,000 pulses per second. It doesn't mean it electrocutes you, but it means that the mechanics is so deep and it's so strong. I always tell this patient, like, is it going to electrocute me? I'm like, no. It's not.
But just don't drink a cup of water at the same time. But
exactly, no, for sure. But what it does, it basically interrupts the pain signals and it reduces the nerve irritation by the mechanics and how it works. So it reduces muscle spasm and it kind of stimulates the nerve. And the way we use it is, for example, we put a patient on the decompression system, we get him off the system, we use a lot of ice, and then we use this device to reduce inflammation. And after we're done with this device, and it works about 25 minutes, reduces the pain, then we'll use laser therapy to stimulate the healing. So when you follow those patterns, then you really see the result, and patient leaves like, wow, I feel so much better. I can't even believe that. Basically numbs the pain without lidocaine. It's really cool.
And then this is sort of, you talked about the ultrasound. Is this the ultrasound or SoftWave? You mentioned this, I think.
Yeah, SoftWave is not. Yeah, SoftWave is not an ultrasound. It's a form of it's not really like a shockwave therapy, because shockwave is very like radial. It's very direct and it's very painful. This has a much bigger circumference, so it's an acoustic sound waves. They actually use it on many different sports team. That stimulates more cellular healing. So, we call it like a stem cell stimulation device, because it stimulates your own basically tissue regeneration. So again, all of them almost do similar things in different ways, but if you use them together, not at the same time, then you achieve a much better outcome. So I have many patients that come in and their pain level, for example, is like 9 out of 10. And we would use one visit of SoftWave and the pain level can drop to sometimes 5 out of 10, sometimes 6 out of 10, sometimes 4 out of 10, but it always drops. So they're like, wow, I feel like the intensity reduced significantly. So that's
and then the idea is by you don't want to hit them with one modality, right? Then you switch it up, so therefore you're not doing the same. They each work at different mechanisms, so therefore
Correct.
You're not overdoing one thing. You can't do so much traction, you can't do so much of the neuromed, or you can't do so much of the muscle stim, or it could damage something. So you kind of mix it up. You keep the body guessing.
Correct. We mix it up. We can mix two of them sometimes together, but we don't mix all of them at the same time. They may get, so for example, if they come in 24 times or 30 times, they may be on the decompression table all of those 24 or 30 times, but they will not get the same modalities in addition to the decompression. So sometimes we'll use the SoftWave, and sometimes we'll use the laser and the neuromed, and and then at the end, the last phase of our rehab, because my advanced spinal restoration treatment has like 3 different phases. Then the last phase, which is basically rebuild and rehab, then we'll use the M-Sculp. So we're not going to use the M-Sculp when the patient comes in severe pain. We're always going to use it at the end.
Got it.
I wanted to talk about, because we do like to talk about sports on this show as well. And we wanted to bring up the 17-year-old gymnast that, the buzz that people were talking about and what she was dealing with when she first walked into your clinic. So can you tell her story a little bit and what that process was to, helping her and to getting her back to where she needed to be as an athlete?
Yeah. So interesting that she was my last case. That's why I wanted to talk about her, because she's training hopefully for the Olympics. We'll see how that works. But she's very young, and her parents brought her because she developed low back pain that really prevented her from doing all her routines. And so, of course, they sent her for an MRI, and she did not have a full herniated disc. But what she did have is that she had disc degenerate. She had like disc desiccation, which is like the disc is starting to dehydrate. And then the facet became a little bit too jammed. So it sounded like, that when she was doing her routines, either they didn't work on some muscle groups, but the pounding and the axial pressure was so strong that it kind of jammed the facets. And it was almost, the MRI showed that it was almost will develop the spondylolysis. And they, at that time, they were afraid for this to happen. So when they brought her,
that's a common thing in gymnasts, what she's trying to bring up. That's common. They can break the actual area where the facet is. So, but that's what she's trying to talk about. Sorry, keep going.
Yeah, no, that's good.
Yeah.
So, with her, because she didn't have a full disc, but, we wanted to kind of rehydrate the disc back, and decompression therapy can rehydrate the disc back. That's part of the physiological effects and responses of the decompression therapy. So, I put her on a 16 session, right? I'm like, okay, she doesn't need 30, because we have.
How does she walk into your office? Just so the listeners or viewers can understand the severity of her walking into your office and what you were dealing with. I'm just backtracking you up a little bit.
Yeah. So, I mean, her parents researched, and they found our office. She walked in. She was in pain, and she was off training. I think she
Okay.
was 2 months off training. So she walked in the office. She normal, but she was just in a lot of pain, and she could not work out. She couldn't train. She couldn't work out. She couldn't do anything. And this is a gymnast that started training when she was, or like doing gymnastics when she was 3 years old. So that's her life. And of course, she was doing national competitions and she's training for the Olympics. So they were extremely concerned because she just couldn't do any other routines. So that was how she walked in, like in terms of limitation. And then when we did the MRI, and then I did an exam, then we saw exactly where the problem was. And I'm okay, well, she doesn't have a herniated or bulging disc, but she has the disc desiccation. So, and she's 16. So the reason, or 17, and she was almost 17. So the reason why I'm bringing up the age is because, young adults, when their growth plates are not completely formed, there are certain modalities that are contraindicated. We don't want to do that. But, again, you have to kind of evaluate the case that's in front of you. And she's an athlete. And, I think, if I'm not mistaken, someone wanted to put her on steroids because she was in pain. And I think that the parents were like, I think this is a little too much to put her on steroids. So they were trying to find something else. So I can't remember if that was the case, but I said, okay, so we're going to do, instead of doing 30 visits, because she doesn't have a herniated disc, we're going to do 16. The reason why I'm giving you a number, because there was some research that was done on decompression, and it shows that you need at least 20 visits for a disc to kind of regenerate. But given the fact that she's so young and it wasn't really bulging, I'm like, let's do 16 sessions of that. And let's really monitor. We'll do the SoftWave. I'm not going to do it directly on the spine, but I'll do it on the paraspinal muscles. And then we'll do a little laser, but I'm not going to do it directly on the bone. We'll do on the muscle. So we did that. And the interesting thing, I then put her on the Sculpt only on the abs to strengthen the core, even though she's a strong, athlete. But that combination really allowed her disc to kind of rehydrate a bit and regenerate. And then I referred her to an athletic, like Olympic athlete trainer, because I asked her, I said, who is training you? And the parents said, nobody. I mean, she kind of trains in the whatever, national gymnastic, whatever that gym is, but nobody specifically. And I said, well, that level of exercise and training really requires a little bit more of a one-on-one attention, because one wrong move, I mean, if someone is not going to watch what she's doing, or not going to really work on maybe her form or correctly on the muscles that she needs to work on, then she can really injure herself, and that can be very detrimental for her career. So we really followed the protocol, but with her specifically, I didn't use the Neuromed, because it's electrical stimulation. We don't want to use it on the growth plate, but I used the decompression very gently. And then I used the SoftWave, and we used the laser, and she rehabilitated back to normal. And the actual exercise the routines that she's able to do right now are just amazing, because she's very strong and very capable. But that little injury really put her out.
I think it's Will. If I talk to the viewers listening this, the problem you have with that MRI findings that she's talking about are, for a surgeon, there's really nothing we can do, right? That's not a surgical situation. There's not a growth plate arrest. There's not an actual fracture of the facets. So this is like the perfect non-surgical treatment regimen, because you don't want to hurt her. You don't want to damage her growth plates. You don't want to damage her disc more. In this situation, as you mentioned, as many of these modalities, while they're effective, they don't do harm. And so that's really the key here, is like, what can we do to make her better? And the fact that, helping rehydrate That's a really weird concept that most people don't understand unless you've either had your own disc herniate or you do disc herniation work. But the idea that the disc will go back in is really true, or it will disappear, but generally resorb. And so the idea behind this is what you're basically trying to do is trying to suck it back in, right? Give it a good environment, have it come back in, so that it can not have to be herniated anymore. The challenge, right, as you mentioned before, is how long can patients make it before they pull the trigger on surgery, because it's absolutely miserable. So if you can find a way to get them more time, they've done studies, right, that show the longer you can do a non-surgical treatment for a disc, the higher chances you don't need surgery. But most people can't make it that long, right? It's just, unless they go to someone like you, right? They have all the modalities. But it's an interesting concept that, you got to get the disc calmed down as soon as possible to try to buy someone more time to see if that'll get better.
And, that takes me now to the whole concept of spinatomy. We have 3 locations. We really would like to, working on being in more locations, because, I feel, and I'm sure you feel the same way, that the general public is more educated and more open-minded to all the alternatives that are out there. And I refer them for surgery all the time. There's certain things that I'm not going to touch because it's too much. There's other thing going on in the spine that they need surgeries. There's certain things that we cannot fix. But the general public is a lot more educated, and they're a lot more open-minded, and they're looking for different solutions, because they don't want just to accept the medication. And, the healthcare system, I think you can agree with me, is inundated with so much. The doctors are so busy. They're overloaded with patients, and people are just looking for different solutions and different options that are available for them. And, they'll hopefully they can find them.
Well, and lower back pain is one of the most common diagnoses we have. And I think it's, of all the things we have, it's the most likely diagnosis that any of us will get. Is lower back pain with disc issues. So it's really cool. Well, again, in the sake of time, we don't want to keep you on much longer, but we really appreciate you coming on. I don't know if Will has any final questions.
Yeah,
but this has been great so far.
We always do. We always want to finish up and ask that question, what's next, right? So what is next when it comes down to technology? Obviously, your office is full of technology, but is there something out there that you're excited, whether it's coming out now or you could see it in horizon, to advance medicine, to advance the relief of back pain that you can focus on?
I mean, I think that for right now, we have pretty much everything. The Sculp Neo, which is the most advanced form of rehab and advanced form of modality. We just recently introduced it into our practice. And we have an Mcella, which is basically works on the pelvic floor. And I think that if we can rehabilitate the whole chain, core to floor, and you basically revive the disc or give it the right environment to heal itself, and you reduce the inflammation and regenerate the tissue, the patient can recover and they can feel much better. Whether they're just before surgery, sometimes even after the surgery, because sometimes they had surgery and they still have some discomfort. So wherever you need to meet them where they're at and try to help them in the whole recovery process. And I mean, I think the technology, look, AI, and look at everything that's going on. I mean, it's just evolving so fast. Who knows what's the next machine that's going to come up to the market, and how it's going to help. But I feel that what's next is, for me, my mission is educating people, really, to give them an option. I always say, you're the patient, you'll make the final decision. I'm here just to give you another option, another perspective. And if you think this is for you, then, we can visit this. And if you think something else is for you, then that's okay too. But I think that if I will educate you on what's available for you, then whenever you make a decision, it's an educated decision, and not just because someone just told you to do certain things or not to do certain things. So that is my mission. That's my next. And I think sending the message across to as many people as possible of the advancements of technology, and to have as many spinatomies as possible to work alongside great surgeons like yourself. Because I think collaboration is the key.
100%.
All right, Dr. Rozenberg, thank you so much for your time. Creator of Advanced Spinal Restoration Therapy. That's so much fun to say. Non-surgical protocol that combines decompression, regenerative biologics, and neuromuscular retraining to get athletes and active people back healthy to feel better. Dr. Garcia, I don't know about you, man. My back's feeling a little stiff with all this conversation.
I've been stretching. He's been talking. I'm trying to get good posture.
I think she put the whammy on us. I'm like, I feel like I need to stretch.
Maybe we should open up anatomy in Seattle.
Yeah.
We need. I want to fall asleep in that unit. That looks amazing. So anyhow, I don't want to digress.
Thank you so much.
If I open up an office in Seattle, I'll let you know.
Thank you.
We're coming. Thank you so much, Dr. Rozenberg.
Thank you for having me. I appreciate the time.
Thank you.
Thank you.
Dr. Garcia, I mean, that was that's phenomenal. No joke, man. I was feeling a certain way, man. But we want to remind all our listeners and viewers, check us out at sportsdoctalk.com. With this show and so many others, we'll have transcripts, we'll have previous shows, we have recommendations. The website's great. You can watch us on YouTube, listen to us on your favorite streaming platform. And as always, we appreciate you, the viewer, you, the listener, and our guests. We have phenomenal guests. We're always learning stuff. I'm telling you, I need a Phoenix, University of Phoenix doctorate at this point with everything that we've been doing. It was great.
Well, thank you.
Yeah. Dr. Garcia, thank you for your time. We really appreciate you. We appreciate all our guests. Any last words for you?
Thanks to the listeners. Keep checking us out. Request as you do, guest requests. We're not going to be able to pick everybody, but we want to make sure we have a good plethora of people on here. So it's been great so far, and stay tuned.
We were robbed. We should have got best podcast. That's all I'm saying.